Hello, welcome to the GLP-1 Hub podcast. I'm Anna Reisdorf, registered dietitian and GLP-1 user, and I have some really exciting news to share. The podcast crossed 50,000 downloads. I think it was last week or the week before, and it is all thanks to listeners like you who have supported the show, and it's like so exciting. I didn't really even think that we were gonna get this far and be so consistent with the episodes. It's a heavy lift to get these episodes out every week, but I really enjoy talking to the guests and bringing you quality information. And yeah, we crossed 50,000 downloads in just 25 episodes, which is really incredible and exciting. Puts us in definitely the top 5% of all podcasts, maybe even more. I don't know. But thank you so much for being here. I couldn't have done it without you. And if you're enjoying the podcast, I still encourage you to leave a review. And if you need help on your GLP-1 journey, be sure to check out the GLP-1 Hub store. We are creating tons of guides over there, but the starter guide is called Beyond the Shot, and you're going to want to check that out when you have a second. And especially if you are new to GLP-1, it's going to give you everything you need to know in terms of nutrition and all of that and how to manage side effects. I'm also doing a mini series over on Instagram, TikTok, and YouTube for people who are just getting started. So I'm just kind of walking you step by step from day -10 to all the way through day 30. Everything that you need to know on your GLP-1 journey. So I am working on that. You can also always email me if you have specific questions that you want me to cover. That's hello@glp-1hub.com. And today I am so excited to welcome one of my just most amazing colleagues, Michelle Routhenstein. She is a cardiac dietitian, and she is so smart about heart health and everything you need to protect your heart. And it's interesting because heart health just doesn't seem to be that sexy of a topic, but it's the number one cause of death in our country is heart disease. So, maybe we should pay a little bit more attention to our hearts. And she is definitely a leader in this space. And I am so grateful she was willing to come on and talk about GLP-1s and heart health and how it's all connected. And I hope you enjoy the conversation. I do want to mention during the podcast, I talk about a hair mineral test that I did. And hair mineral testing is not super evidence-based. There's not really a ton of research to back up the results, but I did get my results and I found that they were extremely aligned with some of the things that I am struggling with my health. And so if you're interested in checking out that hair mineral test, if you have just some underlying things, I'm going to put a link to that in the show notes. If you want to see, what your results are, I will put a disclaimer. The hair mineral test does come with a consultation with the brand, which I did not do because I'm assuming that it's probably just a consultation to sell you their supplements to fix whatever is wrong with your hair minerals. So you can get the hair mineral test without the consultation. And that's what I personally did. So I found the results very interesting. Whether I know how to take action on them or not is another story. So let's hear from our sponsors and get on with the show. One issue that I hear constantly from others on their GLP-1 journey is digestive concerns. Between the smaller meals and a slower gut, these issues are real, but Grüns helps keep things moving. With 6 grams of fiber in just 8 gummies, that's 3 times more than most green powders. If you haven't been introduced yet, Grüns are a convenient, comprehensive formula packed into 8 gummies a day. This isn't a multivitamin, a greens gummy, or a prebiotic. It's all of those things and then some at a fraction of the price. And bonus, it tastes great. So if regular digestion is your struggle, try Grüns and feel the difference. And if you want to give them a try, visit Grüns.co, that's GRUNS.co, and use the code GLP1HUB, that's GLP, the number 1, hub at checkout, and you can get 52% off your order. Hi, welcome to the GLP-1 Hub podcast. Today, I want to welcome one of my colleagues and dear friends, Michelle Routhenstein. She is a cardiac dietitian, literally the best cardiac dietitian on the planet. So she is here to talk about GLP-1s and heart health. So please tell us a little bit more about you and like your career history and how you became the heart health dietitian.
Thank you so much for the warm introduction. I'm excited to be here. I'm Michelle Routhenstein. I'm a cardiovascular dietitian. I have a love and passion for all things heart health in the management, prevention, both primary and secondary of heart disease. So before someone has a cardiovascular event and then also afterwards to really optimize vascular health, heart health, allow for good blood flow to all organs of our bodies so you can live long, healthy, functional lives. So it's really a metric-driven outlook, but looking at all aspects of heart health so that we can improve quality of life, metrics, and making you feel good in your body so you can do the things you love. So love what I do and really have gotten into this field because of really the need. When I was just getting out of my clinical residency as an RD, I had to choose kind of, well, what did I really want to specialize in? Because you know a lot about a lot of different things. And I really wanted to focus on one specific thing so I can really get to that component of it. And I noticed this trend everywhere I went. I worked in kidney clinics. I've worked in weight loss clinics in the ICU. I worked in surgery units, GI units. At the end of the day, heart disease was a big complication that all of these people were going through. And I took a step back. And when you look at the research, year after year, the number one killer is not cancer. It is heart disease in both men and in women. And so I was like, why is this? And then if you dig one more layer, 80 to 90% of it is preventable. So what are we missing here? If it's so preventable, why is it the number one killer year after year? So that was when I actually went to I made my own cardiology fellowship. And I worked alongside heart failure specialists, lipidologists, preventative cardiologists, internists, and really dived into the nutrition arm of vascular disease. So how do we optimize blood flow and reduce the amount of plaque in the arteries, prevent that plaque promotion, making sure the heart is pumping well, making sure that our heart is beating in sinus rhythm so that we don't have heartbeat irregularities. So I worked alongside varying specialties and really took in that arm of cardiovascular disease. And I've been doing this for over 13 years. And I just love it because the power of nutrition is so strong, especially when it comes to heart health and vascular health. And I see that by just shocking results from my clients where doctors will be like, I didn't know that was possible with nutrition. So I love what I do and I love seeing the success because we have so much power when we really dive deep into that nutrition arm.
So why do you think that people don't realize that it's like 80 to 90% preventable, like you said?
A lot of times people don't think about it, right? So heart disease is a progressive disease. So you can be an athlete, you can be underweight, you can be overweight, you can be normal weight, you can have a six-pack and have plaque forming in your arteries. So it is a progressive disease and it's silent. You can have high blood pressure and not know it. And so these things are brewing silently until a heart attack happens, a stroke happens. Most people who have those things, they're like, I never thought I would have a heart attack. And so it's really about understanding that things are brewing silently that we don't see. But if we are being more metric driven and we look to see our cholesterol panel, our blood pressure, our insulin resistance, our blood sugar, all of these things matter. And if they're elevated for a prolonged period of time, coupled with inflammation and oxidative stress, it's a storm that's brewing and you don't feel it until there's, God forbid, a blockage or a rupture and a blood clot. So we really want to be looking at this more preventive in that prevention mindset. And because you don't feel heart disease, you don't think that it's happening.
Right. It's like I don't want to say silent killer. That sounds dramatic, but I guess it is.
It is called that because
Sure.
it unfortunately is true. And so bringing awareness to, hey, I can take an empowered approach. I can reduce my risk no matter where you are in your journey is really empowering to say, this is preventable. Even if I have a strong family history, this is preventable. I need to take action sooner rather than later because heart disease doesn't wait for when you're ready to tackle it. It brews silently and we need to be addressing it timely.
Right. So If you're, let's say, I mean, I know you work with complex patients, unfortunately, probably further down the line. But if you're a person who, okay, well, I know this thing is brewing, what are a couple of steps they could take to start to like delay that brewing, delay that explosion?
Well, I always say know your numbers, but then do something about it if it's high. So if
Uh-huh.
I were to tell you the one metric that's really important that everyone can do and do it tomorrow is test your blood pressure. So if your blood pressure is above 120/80, your heart is under strain, it's under stress. And a lot of people think only about cholesterol when it comes to plaque deposition in terms of making of that atherosclerosis, but your blood pressure actually can damage your endothelial lining, causing that micro tear that leads to the cholesterol buildup and all the things to go under and cause issues. So I always say, test your blood pressure. We really want it to be 110/70. And if it is elevated, then we have to understand why. So there's many reasons for elevated blood pressure, whether it's from insulin resistance, whether it's from nutrient inadequacies, so low potassium, magnesium, calcium from food can cause that. It can also be from low nitric oxide bioavailability, which is really a sign of poor gut health. So there's a lot of arms of why blood pressure could be high. So we want to understand why and then address that through science-based nutrition, because nutrition lowers blood pressure a lot of times more than many medications may.
Sure, definitely. And so for the listeners of this podcast, where do the GLP-1s play a role? Because I heard you mention inflammation, but I also heard you say that you can be a normal weight, underweight, overweight, whatever weight, and still have this brewing. So are the GLP-1s helpful in reducing your risk or neutral, or you still got to do all the other things? Like, where are we at?
Yeah, so GLP-1s in the research really show really great benefit for cardiovascular health. We do see that it can reduce the risk of major adverse cardiovascular events. We see it helpful with reducing not just the weight around your abdominal region, but actually can potentially reduce epicardial fat, so the fat around the heart muscle. And so we see that there are a lot of benefits to it. Is it the only solution for heart health? No, but it can be a really great tool. And there are many of my clients who are taking GLP-1s. And with that, we just need to make sure that you're getting the nutrients you need. I've seen a lot of people who will go on a GLP-1 and they'll only have an appetite for one meal a day. It's really hard to get all of your vitamins and minerals in one meal for your body to digest that and utilize it. So we really need to go in to say, okay, what are you eating? And are you getting the most bang for your buck so that you are getting your potassium, magnesium, fiber, protein, manganese, calcium, all of those nutrients so that we are protecting your bones and your eyes and your gut and your heart health because we're focusing on getting all of those nutrients into your body.
So we talk a lot about protein here, but like you mentioned a lot of micronutrients as well. Potassium, I know, is a big one for heart health and magnesium and some of these. What are a couple foods that someone might eat or try to include if they're on a GLP-1, not eating very much, already over focused on protein, and then they need these other things too?
Yeah, so there are some foods that have protein and these nutrients in there. So I think that would be a better starting point,
Uh-huh.
right? So think of like yogurts rich in magnesium and calcium and potassium. Your lentils are rich in in the magnesium and the potassium. Your fish is rich in potassium and magnesium. So those are really great starting points too, but really being intentional of how many times are you eating and making sure that those foods are at every meal that you eat to get to the thresholds. Because take, for instance, potassium. You need about 4,700 milligrams a day. And you can't supplement with potassium because that can actually cause cardiac arrhythmias. It's capped in the supplement industry at 99 milligrams. So if you take a capsule of 99 milligrams, you can't get to 4,700 milligrams. So it's really about intentionally planning of, okay, where am I getting it in and making sure it's part of every meal so that you can get to that amount that you need in a day.
Mm-hmm. That's so fascinating because we focus so much on protein and then protein and then and like, while it's important, some of these nutrients are important as well, and the reduced calorie makes it really hard.
Yeah, well, I think there's also some studies showing, okay, does GLP-1s cause bone loss? Well, GLP-1s could cause bone loss just because of rapid weight loss. So depending on how it is affecting your body, that's one. But it's also nutrients. What does your bones need to maintain? It needs calcium, magnesium, K2, vitamin D. Are you getting that? And that's the big thing. I think a lot of times the complications come from, are you nutrient adequate? Because if you're not, then it can cause other issues, right? There was a really poor study showing about like eye health and GLP-1s. Well, are
Mhm.
you getting beta carotene? Are you getting the lutein and the xanthan that you need? If you are, you probably won't get that side effect. So I always say, like, I think GLP-1s are so helpful and they have so many positive benefits, but I always want it to be paired with nutrition to really make sure all the side effects are low and that you're protecting all your organs when you're on it.
Sure, definitely. And so, a couple of things I wanted to ask you about. I've seen just in the chatter on the Facebook groups and on the things that people on GLP-1s, their blood pressure goes up. Do you have any ideas about why that might be? And if it's maybe nutrition related or something else? Have you seen that as a side effect of the medication at all?
That's interesting. I haven't necessarily seen that with my clients particularly, but I can maybe hypothesize a
Yeah.
couple of reasons. So, if someone's on a GLP-1, right, the GLP-1 can slow gastric emptying. And if we're eating too much at one time or we're not eating the necessarily right foods at the right time, and it causes indigestion or it causes acid reflux or it causes any regurgitation, so to speak, which is a common side effect, that can cause inflammation, but it can actually kind of almost like backfire into the proximity of your left atrium, which can cause some changes in terms of the arrhythmias. And so sometimes people get arrhythmias from indigestion. It's called a vagus stimulated AFib or vagus stimulated arrhythmias. So I think part of it, that could be a cause for it. So kind of evaluating that aspect of things. We also do see the gut microbiome and blood pressure very closely linked. So when individuals have some level of gut health issues and there's inflammation brewing, we do see in previous studies that also linking to high blood pressure. So I would check in on that component primarily. I'd also look at the beverages you're consuming. So if someone's consuming a lot of coffee, or they're consuming any stimulants, or they're consuming anything for energy because they feel their energy is lower, that can increase blood pressure. So that can also be a component in there too.
Interesting. And I asked you before, but personally, my cholesterol levels went up since I've been on the GLP-1. I haven't had it checked that recently. I lost 40 pounds and I was surprised that happened. And you mentioned to me briefly that it was maybe because of constipation. So can you explain the connection between cholesterol levels and gut health and constipation or whatever might be
Yeah.
going on?
So I always talk about bowel movements with my clients because it's part of the reduction of cholesterol. So in order for you to get rid of excess cholesterol, one of the ways is through your gut. So it binds it. If you're eating the right foods, you bind the cholesterol in the gut, then you broom it out when you go to the bathroom. And so if you're constipated, you're not really brooming it out. So making sure that you have good, effective bowel movements is big. And one of the ways we assess that is something we call the Bristol stool chart. So it's the stool chart that looks about, it kind of has diagrams and pictures of your stool so you can compare because everyone's regular is different. And so knowing kind of like, well, where am I on this scale can help. And it's graded by 1 through 7. And so ideally, you want to be a 4. That's an effective bowel movement. It's easy to pass, it's formed, and there's no issues or straining going on. But if you're at a 1 or a 2 and you're constipated, it can be a cause or a reason why cholesterol is high because you're not eliminating the cholesterol through the gut.
Mm-hmm. Right. So, because the cholesterol is needed to make the bile that digests the fat. And so that's how it's used up, right? So it needs to come out
Right.
that way.
In order for you, it needs to be bound. So if it's not bound, you can't get rid of it. So that's
Right.
one aspect of it. The other thing is, well, what are we eating? Because maybe someone's going on a ketogenic diet that's high in saturated fat. And if that is above your threshold, saturated fat actually downregulates the LDL receptors that on the liver that break down LDL. So more LDL is now in the bloodstream. So it could be multifactorial, right? Someone's really focused on protein only. They're having a very high protein diet and it's high in saturated fat, and that also can increase cholesterol. So the two components of it there are many components of why cholesterol can become elevated with a GLP.
I hope you're able to catch Sarah Kennedy's fascinating interview last week about CaloCurb. CaloCurb is a 100% natural appetite management supplement featuring amorosate, a patented hops extract developed in New Zealand over 15 years and backed by $30 million in scientific research from Plant and Food Research, New Zealand's largest Crown Research Institute. It works by activating gut-brain signals, including GLP, to help you feel full faster. It's clinically shown to reduce cravings by 40%, hunger by 30%, and calorie intake by 18% in just 1 hour. So whether you're working on general weight loss, maintaining your progress, or transitioning off GLP-1s, CaloCurb is a natural and effective support tool to help you stay on track. And you can use the code ANNA, ANA10, to get 10% off your order at calocurb.com. That's Anna, ANA10 at CALOCURB.com. And now it's time for our hero bread tip of the week. Every time I go to brunch, I always look for smoked salmon and a bagel on the menu, but really not that high in protein. And the traditional bagel doesn't have a lot of fiber and is pretty high in carbs. But the Hero Bagel allows me to enjoy my favorite breakfast while still meeting my protein and fiber goals. So if you want to make a bagel with cream cheese, you want to toast the Hero Bagel, put light cream cheese on it, add smoked salmon, sliced cucumbers, capers, sliced tomatoes, all of the toppings. And this filling breakfast has over 25 grams of protein and more than 21 grams of fiber. That is the best part. So if you want to give the Hero Bagels a try or any of their awesome products, you can get 10% off your first order with the code GLP1HUB at Hero. That's GLP, the number 1, Hub at Hero. So if you are having constipation on a GLP-1, like what are some things that you can do to improve it? Because I see that as a major complaint for a lot of people.
Yeah. So I always look at it from a couple of aspects. In order for you to have a good bowel movement, you need 3 components. You need adequate amounts of fiber, but you need to do that slowly. And you need 2 types of fiber. You need insoluble and you need soluble fiber in order for you to bind cholesterol, make actual form stool, and then a broom that pushes it out. So you need adequate amounts of that slowly. If you go too quickly, you will become constipated. Your gut doesn't know how to process that. But even before you add the fiber, make sure hydration's in place. If you're dehydrated, then that can also be a cause for constipation. You need liquid to move things along. And then you also need to be moving. So that walking, that movement is also going to help facilitate movement as well. And then we slowly increase fiber because if it's too quick, too fast, your gut doesn't know what to do with it and it even slows down further. So consider small, frequent meals as well to help with digesting the food and allowing for that process to take place more seamlessly.
There's also a lot of chat about magnesium supplements for constipation, possibly probiotics. Is there anything that you recommend?
I'm always a food first practitioner, and especially when it comes to these types of supplements too, because think about it, if GLP-1 slow down digestion, it's also it's harder to process a lot extra supplementation too. And we don't want to fill up your gut with that. We want to fill it up with nutrient-dense foods. We have to be careful with magnesium. I think a lot of people overload on magnesium where they take 800 milligrams, 1,000 milligrams, and that can actually negatively impact your bone health. But the laxative form of magnesium is magnesium oxide, and it actually can pull other nutrients out of your system if you're having it routinely. So I always like to get to the root cause of it by nutrition versus a supplement, because your body will then get used to that amount of magnesium. You'll need more and more, and you become dependent on it.
Right. And so for a person on a GLP-1, I know you like to approach it with food. Is there anything that you do recommend that they supplement with just because of the lower calorie in?
So it's really personalized. I think
Mhm.
to say that everyone should be on one supplement is not really looking at the person itself. I have a lot of people who are on GLP-1s and it helps them reduce the noise, but they're still eating 3 meals and a snack or two a day, and they're easy to get their caloric needs and all of their nutrient needs. So in that person, and they eat a well-balanced diet, they don't really need the extra supplementation. If somebody has low iron levels from a GLP-1 or they can't get enough calcium or whatever it might be because their appetite is more suppressed than usual, we'd have to really evaluate on a case to case basis what they are deficient in and what do they need to supplement. I always like to put a word out of caution that more is not better. I think we live in a very like, oh, I need this, so I'm going to have a lot of it versus like, no, this is how much I need. I'm going to have what I need because there's a lot, especially with supplements, toxicity is real. And we want to make sure that we're not causing any issues on our liver and our kidneys and so on and so forth.
Right. So you mentioned earlier on about knowing your lab values. So for just general heart health and also for somebody on GLP-1, like what are some of the things they should get checked up on regularly or every 6 months or a year or whatever?
Yeah, it's a great question. So I always like to look at your lipid panel, specifically your non-HDL cholesterol and your apolipoprotein B. It's called ApoB. If you can't get an ApoB, your non-HDL cholesterol, which is on a standard lipid panel, can assess not for the atherogenicity of the LDL. So you take your total, you subtract your HDL, and you get your non-HDL cholesterol level. And ideally, in the general population, it should be less than 130 milligrams per deciliter. But if you have a high risk of heart disease or you have heart disease, we target that to be less than 100 milligrams per deciliter.
Mhm.
I like to look at HSCRP, which is inflammation, and we like to target that to be less than 1 milligram per deciliter. I also like to make sure checking blood pressure at home. I know that's not a lab, but definitely reminding you to do that. And then I also like to look at your hemoglobin A1C, so your 3 month average of your blood sugar levels, and also your fasting insulin. It tells us kind of, it gives us a little bit more of information on insulin resistance as well.
Mhm.
Besides those, I like looking at a complete metabolic panel, checking your liver health, your kidney health, making sure that things are in the right range. But also, I always like to say when you look at your labs, it's important that A, you understand them, but B, you are looking at trends. Because if you see, oh, wow, this is it, my EGFR, your kidney function was 150 last year and now 115, and now it's 50, you're not going to get flagged. But there's something going on. There's some stress on the kidneys that we need to be looking closer at. So I like to always trend year to year to make sure that we are addressing any things that are going in the wrong direction, because that's really where prevention takes place. It doesn't take place when things are in the red and now your doctor wants you to put you on medication. We have an arm in the middle where we can really have high impact.
Do you recommend any vitamin or mineral labs?
They're not really accurate. I
Sure.
always do vitamin D. I do like checking for homocysteine. I like checking for methylmalonic acid, your
Mhm.
B12. I like checking for like serum magnesium or certain ones if I suspect a deficiency. But more or less, and I like looking at iron panels. Those are like the main minerals and labs I look at. The honest truth is, you usually have to be very deficient for it to be picked up on a lab because it's not, your body's really good at ACEs in terms of getting what it needs in the blood to maintain heart
Mhm.
rhythm and maintain all these metrics, right? So take, for instance, calcium. So calcium, a lot of times people are like, oh, my calcium's great. I'm eating enough calcium. I'm like, no, 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 no. It has nothing to do with how much calcium you're eating. If you don't have enough calcium in your blood, your body takes it from your bones. And it does that because your heart needs calcium for it to contract and for it to beat regularly. And so you have a reservoir. And so you don't know if it's coming out of your bones or not. So you need to have adequate calcium to avoid that from happening, but it does not reflect the actual amount on your labs. Same thing with potassium. A lot of times people are like, oh, I'm eating enough potassium. My potassium's in normal range. I'm like, no, no, no. Your kidneys are really good at making sure that you have enough in your blood, but that doesn't mean you're necessarily eating enough for vascular health. So, we have to understand how those metrics are really dove into. There are some places that does like hair now of labs, it's really not seen as an accurate assessment, to be honest. So there are some labs we can look at, but we have to kind of look at the whole picture and dive into your diet to really get a better feel for where you may be deficient in.
So a company is sending me a hair analysis thing for free, so I'll report back. Just gonna try it. I mean, what's it hurt? Like we'll
Yeah,
see.
I mean,
We'll see what comes up.
I've seen a lot of people do that, and like some of it, is interesting in what comes up, but it's not
Yeah,
really validated. I don't think there's any harm in knowing that, but it's not really in your serum. It's outside your body, so it's not 100% accurate.
sure. No, and that's what I had read about it in the past, but I was like, oh, you want to send it? Okay, well, I'll try it. Doesn't hurt. So you mentioned bone health a couple of times. And a few months ago, there was some singer who came out and said that GLP-1 gave her osteoporosis or osteopenia or something. So how can we protect our bones while not eating very much? I know it's not really your area of expertise, but
It's actually really connected with heart disease. I do a lot of lectures on bone health and
do
heart
you?
health, and I really push the connection. 80% of people who have osteoporosis have coronary artery disease. And it's, you think of your bones as its own unit. It's actually, osteoporosis is called inflammatory metabolic bone disease. So there's a link between both coronary artery disease and plaque formation and bone health. So it is very connected. So the thing is are you getting enough nutrients, right? We always talk about calcium, and that's really important when you are just in general, whether you're on a GLP-1 or you're not, are you getting enough calcium? And usually as we age, we need more. So about 1,000 to 1,200 milligrams per day. But calcium, it needs certain helpers to be actually facilitated into the bones. So it needs your magnesium, it needs your vitamin D, it needs your K2, it needs your boron, it needs your phenolanic acids. It needs a lot of that. So we want to make sure that you're getting enough nutrients. And if not, then we supplement where we see those gaps in small quantities. Your body can't digest more than 500 milligrams in one sitting of calcium, and that remainder can potentially end up in plaque. So super important that we're supplementing low dosages, but we want to make sure that's there. We want to make sure inflammation's addressed, because if inflammation's present, bone loss happens more, coronary artery disease happens more. We also want to make sure the resistance exercise and the protein adequacy is there too, because when you have good muscle mass around your bones, you reduce the risk of fractures. And that's the biggest thing, right? Just because you have osteoporosis doesn't mean you're going to have a fracture. It just means your risk is increased. So if your risk is increased, but you have muscles to support it, your balance is good, you have good flexibility, motility training, and balance training, you're going to prevent the negative effects of potentially getting a fracture too. So there's a lot of components here, but we have to pay attention to our bones. They matter for so many aspects, and it's really about nutrient adequacy, inflammation, exercise, to really help with that.
Because I know that some people, they tend to lose muscle if they're not getting enough nutrients on the GLP-1. And so that could exacerbate all of this in the future. That's a big concern that I have personally. It's like, where are these people going to be in 10, 15 years or however long if that happens to them?
Yeah, I think the biggest component here is the nutrient adequacy that's not really discussed and really should be, because our bodies need nutrients, and temporarily it has some storage, it has reservoirs, but if we go deep into our calcium reservoir, our bones are going to weaken. That's just what happens. So we have to have that on front of our mind of, yes, protein matters, but where is everything else in the picture too?
Right. So just for some final thoughts on GLP-1s and heart health, where do you see the future? Like, where are you concerned about people not fully understanding what they're doing? What are your thoughts on where we're headed with this?
I think GLP-1s can be a really great component to this picture. I think it can have it really can help so many people. I just really don't want people to ignore symptoms. I don't want people to ignore I'm not eating anything. That's not a good thing. Your body needs nourishment. It's great that it's cutting the food noise. It's great that it's really helping with that piece of the picture. But I really just want to emphasize it can work really well. We see really good results, but I don't want people to ignore the GI side effects. If that's happening, meet with a dietitian who can help through that. make sure you're looking at your nutrient components and looking at all aspects, because this is a helping tool within nutrition to really optimize your heart health. And we just need to be looking at all aspects of it. And I think it could really be great. I just think that, I've seen a lot of people say, I have all these side effects, but my doctor says I have to be on it. And I'm like, well, let's address those side effects. You shouldn't be having diarrhea or acid reflux and nausea and being uncomfortable. That's a quality of life metric we need to make sure we're addressing. And so if you are looking at a nutrient adequate diet on a GLP-1, I think it can really be a revolutionary component to heart health, and I'm excited for it.
Good. Good. That's awesome. I'm happy to hear that. So where can people find out about you and your amazing programs and your life-changing work?
EntirelyNourished.com. You can visit my website. On there, you'll see all the links to my Instagram, where I put out some information, my LinkedIn, my YouTube channel. I have my email list where I give a lot of heart disease prevention tips. If you're looking for more support on the heart health realm, I have group programs, I have one-on-one programs, all on my website that you can check out.
Yeah, Michelle she's just amazing with the work that she does with heart health. And it's surprising to me always that there aren't like a million heart health dietitians, considering it's the #1 cause of death, you know? But we're lucky to have you and your smart brain. So
thank you so much.
You're welcome. You're welcome. And thank you so much for being here. And I'll be sure to put all the links so you guys can connect with Michelle and learn more about the great work that she does through, with the GLP-1s and the heart and all the things. So thank you so much once again.
Thank you.
All right. I hope you enjoyed this episode of the GLP-1 Hub podcast. Michelle is just so smart about heart health and all the things. So I encourage you to follow her on social media or sign up for her email list. She has a lot of good information if you would like to manage your heart health. And once again, just a reminder, if you are enjoying the show, please leave a review. It really helps the show continue to grow. And maybe by the end of the year, we'll hit 100,000 downloads. I mean, who knows? And just a reminder, if you need support on your GLP-1 journey, make sure you visit our GLP-1 Hub store. We have meal plans, recipe collections, and that Beyond the Shot guide if you are just getting started. And I look forward to seeing you in the next episode. Thank you to Grüns for sponsoring this episode. If you're on a GLP-1 journey, Grüns are a convenient, comprehensive formula packed into 8 gummies a day. This isn't a multivitamin, a grains gummy, or a prebiotic. It's all of those things and then some at a fraction of the price. And bonus, it also tastes great. So if you want to get up to 2% off your order, you're going to want to visit grüns.co. That's GRUNS.co and use the code GLP, the number 1 hub at checkout. That's GLP-1 hub at checkout to get 52% off your order. And we'll see you next week.